Health insurance is one of the biggest barriers to achieving financial independence. But is HealthCare.Gov the solution for a lot of us? Stay to the end because I'm going to actually give you a real life example, because right now my spouse is using HealthCare.Gov in order to meet our healthcare needs. Let's first talk about a little bit of some average costs. So a really quick search on the internet will find that the average cost, at least in 2020, for health insurance was $456 if you are single and $1,152 if you are a family, and that is a monthly premium. So that is the average monthly premium for someone who's single and someone who has a family that's covering that family. And if you don't know already, that's a lot of money, especially for us in the middle class, in that middle range, us normal people, as I like to call us normies. So that's a lot of money, and that is very expensive. So that's going to be very hard to replicate if you're thinking if you have to achieve financial independence and you have to pay for all of that out of your pocket. If you were going to be using the 4% rule and achieving financial independence and you had to pay these premiums, then what we're going to have to do is take that monthly figure. So in this case, let me do the single person for the example. $456 per month. We multiply that by 12 to get an annual number of $5,472 per year. And then we can multiply that by 25 by using the, I did the little accent with the 25. Then we can multiply that by 25, and we can equal to $136,800 of assets that you're going to need in order to support that health insurance bill, that healthcare bill. So that's a lot of assets that you're going to need in order to cover it, right? But maybe HealthCare.Gov is a solution to this, maybe. So what is HealthCare.Gov? So it's a website. If you didn't know that, the dot and then the gov means it's a government website. It was created by the ACA, the Affordable Care Act. And basically it is a marketplace where you can find health insurance plans, and these health insurance plans could be eligible for you to get a tax credit known as the premium tax credit that pays for part of your health insurance plan. So basically you're getting a tax credit to pay for some of your health insurance costs, but you have to get a health insurance plan through this website, and you have to sign up through this website and get it all done right on there. When you're going to enroll in this, it's going to be anywhere from November 1st to January 15th for that upcoming year. So right now, as I make this video, it's still 2021, and so anywhere from November 1st, 2021 until January 15th, 2022 is generally the time that you can enroll for a plan that is available in 2022. Now there are special enrollment periods and things like that, but that is like your basic, that's usually when you're going to enroll or when you're going to change plans and things like that. And then when you are enrolling in a plan, what you can do is you can possibly qualify for the premium tax credit. So this tax credit is going to be based on what your actual income is. Generally, the lower of your income, the more of the tax credit you're going to get. And the higher your income is, the less of a tax credit you're going to get until eventually, if your income reaches a certain cap, then you're not going to qualify for any of the tax credit. Now, I believe that it doesn't necessarily mean that you can't get a plan like through this marketplace. It just means that you might not get a tax credit to help pay for that plan. All you have to do in order to estimate how much you're going to get for a premium tax credit through this website is you have to input your income, like what your expected income is, and you can input your household info, basically how many people you have in your household. And then generally you have an option to where you can take the full tax credit you're eligible for, you can take part of the tax credit that you're eligible for, or you can take no credit that you're eligible for. And then at the end of the year, when you go to file your taxes, you can get all of that tax credit back in the form of a refund. So it just depends on what you want to do. And if you like tax credits, by the way, then make sure that you like this video because we got a lot more to talk about when it comes to the premium tax credit. So that is a very overgeneralized view of how it's going to work, how you're going to sign up for a health insurance plan. But let me give you a real life example, because as I mentioned before, me personally, I am utilizing HealthCare.Gov for my wife's health insurance plans. Now, I am thankful for myself that I have access to VA healthcare because I was in the military, and so I get access to VA healthcare, and so my healthcare costs are already accounted for, and I'm very thankful for that, and it's really helpful when you're trying to achieve financial independence. But my wife, on the other hand, she is not so lucky. She does not get to enroll in VA healthcare, and so we have to find alternatives. In this case, right now, currently with our situation, HealthCare.Gov marketplace is the good alternative, probably the best alternative for us at this moment. And so I'm going to give you pretty much a very realistic scenario on how much it's going to cost in order to get a HealthCare.Gov plan. So think of this scenario as you're financially independent, which is kind of what I'm living that lifestyle right now. I'm kind of financially independent. Well, technically I'm barista fire because I'm still making these videos for you. But so you're living the financial independence lifestyle, and then I'm gonna actually use a single example just because I know that most of the audience out there is single and not actually married financially, because it's just me right here on this page. So I guess that the men are drawn to watching men talk about finances. I don't know. So that's what I'm going to be using. You're financially independent, you're single, and you're going to be using my zip code. But I'm not going to tell you what my zip code is just yet. I don't know if we're that close to friends yet. But basically, when you're going to go, you go onto HealthCare.Gov. You can see their plans and you can get an estimate. So I'm going to first enter in my zip code on there, and then I'm going to enter in my household info. In this case, my hypothetical scenario is going to be single. And then I'm going to go ahead and estimate an income in here. So let's say that you're financially independent, and if you're single and you're fairly frugal, you can live on $30,000 per month. Not per month. Not per month. I mean per year. $30,000 per month. That's a lot of money. Okay, that's a lot of money to me. Maybe not to you. But okay, $30,000 per year. That's going to be $2,500 per month. So if you're single, you're living in a low cost of living area, you're financially independent, I think you can live a pretty good lifestyle on $2,500 per month. So making $30,000 per year, how much is your healthcare going to cost? Well, you can see that they first list off the cheapest plans on there and they go in order. But me personally, what I would kind of recommend and what I really like and prefer is that if you are healthy and you generally don't have very high healthcare costs already, look for a high deductible health plan that could get you eligible for an HSA or a health savings account, because that's going to offer some other benefits that are perfect for another related video. But this way, you can see on there that if we choose a plan with an HSA where I live, then it's going to cost you less than $100 per month in order to have a health insurance plan. And that's not bad. Even if you didn't go after a plan with the HSA, apparently they have plans that are even less than that. I think that it would be good for you to go ahead and check out HealthCare.Gov and maybe see how much it would cost you, especially if you're planning on becoming financially independent soon. You can check out, if you plan on living somewhere, moving somewhere else, you can check out the zip code and how much income you plan to make per year, approximately. And you can see maybe if you do use this HealthCare.Gov, how much it's going to cost you for a health insurance plan. Is it a perfect system? Is it ideal for you to have to use HealthCare.Gov to meet your healthcare needs while you're financially independent? Maybe not, maybe it is, but it's the best thing that I think that is available to us, and it could be another tool that you could use on your path to financial independence. Another tool that you could definitely use on your path to financial independence is watch another video that I created actually explaining health savings accounts. So the HSA explained video that I made. If you want to learn a little bit more about health savings accounts, and you definitely should, then make sure you watch that video. Thank you so much for watching this video. I'm Zach from OnCashflow.com, and I hope to see you next time.